I'm Gloria Strode and welcome to Straightforward. Today I have my awesome friend Kim Betton from the United States Veterans Administration Healthcare Team.
Thank you.
That's a mouthful.
Yes, indeed.
Well, you all are covering Central Alabama, which includes Columbus and Fort Benning. So I just want to make sure that our viewers know that not only are you serving the people over in Montgomery and Tuskegee, but you all are taking care of our veterans here at Fort Benning and in the city of Columbus.
That's right.
Yeah.
That's right. We love it. We love it.
I know you all are doing a great job.
Thank
you got
you.
a lot of wonderful things that's going on. I was so excited when you shared with me about a new project that you all are collaborating with Goodwill on.
Yes.
And of course, we don't have it here in our area, but my dream is once they hear that Goodwill over in the Montgomery, in your river area.
River region, that's right.
The river region is doing this for our veterans that we can jump on board here.
Oh, yeah.
Share that with our audience.
Yes, we kicked off our bike drive for veterans on October the 1st, and it runs through November the 9th. And all across the river region at Goodwill Industries, Goodwill stores,
Yes.
We're asking residents to donate bicycles, working bicycles, hopefully, that they can just donate them at the Goodwill Industries stores, and we will collect them and give them to our veterans in need. And they could be bikes for children, veterans' children, bikes for adults, of course, and this will help veterans to get out and move.
Right.
I need to move. we can
physically
all little
fit,
move,
but
right?
it might be their mode of transportation.
Mode of transportation. It helps, to get to and fro to different places, to move, and just to recreational, So, and we want, of course, we want to be safe when you're biking, of course,
Right.
and we ask drivers to be safe as well when they're driving, and see bikers. So we want people to get outdoors too. So it really works. It's like a cycle of success, if you
Right.
will. So if you have a bicycle, we're asking folks to just drop them off at all of the Goodwill Industry stores in the Montgomery, Alabama River region. And of course, if someone here in Columbus would like to contribute, they can always do that too.
Exactly.
Yes.
And that's what we'd love to have. You all have a lot of things on where people are on board over in the Montgomery area, because that's kind of the hub for this area. But we want that to just spread abroad, because we actually have, and I'm going to move to this, this is near and dear to my heart. Last time you were here, we were getting ready for that awesome homeless veteran stand down. We have homeless veterans in our area. You actually had some to get housing that same day, the keys. And we were all excited.
I know, I took pictures of that. Wasn't that great?
That was really awesome.
Yeah, we have a great program.
Yes,
we do.
yes.
Our homeless veterans, we love them. We love all of our veterans, and our social work team put that on.
Yes.
Gloria, and they did a great job.
They
and it's
did.
routine.
Yes.
We just had one in Montgomery, a stand down in Montgomery. We have one in Columbus when you were there. We talked about it. Yes, we want our homeless veterans to
know that you didn't
about
forget about it.
And it's not just on the stand down day. It's 365 days a
Right,
year,
because you actually have a team.
Yes.
Mr. Reed and his team, they're out on the street.
Span,
Dr. Span, they're out looking for people.
They are.
To take care of our veterans. And so some of them, have health issues. We're going to get to some about the PTSD. We're going to talk later about the suicide prevention and that kind of thing. But you all had your team out on the street looking for people. And then lining them up with the resources, one-stop shop.
Yes.
Every resource from Montgomery was in the house.
It's partnerships.
People could just go from one table to the other. No, really, that was really phenomenal. It was like, okay, so is anybody over at the Montgomery office? Because you all brought every resource. So if people had a hard time and they lost being transient, the DD-214, you had somebody on the spot that could help them out with that.
That's right.
Because they need that to get a lot of those other services.
That's right.
Right. And everything is free.
Yes, we talked with our veterans from haircuts to homes to legal benefits to health benefits to legal advice to just support, spiritual advice, our chaplain service.
I did meet them for the counseling
there.
and you all thought of everything.
Yes.
And anything that a soldier or a veteran might need, you had it under that one roof.
We have this concept called whole health. And whole health is the whole you.
Okay.
The whole veteran. And we want to take care of the veteran from spiritual, if they choose to emotional, to physical, you know, to health, primary health care. It's whole health. And you'll hear more about that, the buzzword, whole health.
Okay, so
we're
that's
gonna
the
work
new
to get
thing
it. We're
now.
going to work to get it out.
Yes.
Because we care. We care. And it's important. There are veterans who really appreciate what we do, and there are employees who love what we do.
Right.
And we're there. We're there. And we want people to know that I'm here. I'm here to help.
I know.
You know, anybody who knows me knows Kim is for real.
Yeah, Kim is for real. Kim's been on the road. And I caught her on the road in between places, and I was like, you really have to come, because I really, you know, we're going to be moving into the holiday season. And there's some specific things we must get out, you know, for our veterans, so they'll know that we didn't forget them. We appreciate them and all of their service. And so you all have put some things in place that if they just reach out, if they have a family member that can reach out for them, then they can just connect, and then we can help them to go forward. But before we go any deeper into some of all of these other great things, I get so excited every time I see you, because you're excited.
You too.
But it's clear it's a passion.
Oh, I love people.
And
I love people.
And when you really want to help people, you get excited about that.
Yes.
So what we're going to do is go to our first break, to our sponsors, and then we're going to come back and talk about some of all these other great programs that you have going.
Thank you.
Okay. All right. We'll be right back after word from some of our sponsors. Straightforward is brought to you by Chalk by Quincy introduces Excellence Redefined, timepieces of the finest technology, luxury, and class with tons of style at chalklifestyle.com. Renal Associates, LLC, a team of physicians dedicated to excellent kidney care with 5 convenient locations to serve you: Stark Avenue, Columbus; Bradley Park Drive, Columbus; Lafayette Parkway, LaGrange; West Washington Street, Eufaula; and Spring Street in Warm Springs. Vanessa Jackson's District 3 Successful Scholars Program, supporting students in achieving academic excellence, outstanding citizenship, positive social and cultural growth, believing in success for kids. Dr. Sheikha Shaw Family Medicine, connecting your health to your future. Dr. Shaw prides herself in providing compassionate health care and establishing long-lasting relationships. Conveniently located at 2827 Warm Springs Road, Suite 3B. Call her today at 706-324-4177. B&O Services, consumer-focused personal care homes, providing innovative and integrated services for persons with developmental disabilities, creating quality experiences with a loving hands approach. For more information, call 706-330-1826 or visit bnoservices.com. Welcome back to Straightforward. I'm continuing my conversation with the awesome Kim Betton from the Veterans Administration Healthcare, Central Alabama, taking care of Alabama, Fort Benning, and Columbus. I get so excited when I'm talking to you, even on the phone, because your passion, it comes through.
Thank you.
And when people don't like their job, that comes through too. But you were telling me as you were traveling, when I tracked you down, and you were so nice to take my call.
Thank you.
And sharing some of the great things that you all are doing. Trying to make the VA healthcare more efficient. And our biggest thing we need to kind of shore up, and because we have Columbus, Fort Benning, a lot of veterans here, is the no-show campaign.
Oh, yes.
I don't think that sometimes we don't understand what it's like when we miss an appointment, which could have been an appointment for another veteran. Right. So share with us the no-show campaign.
Yes, the no-show campaign. We just want the veterans to call us. If a veteran needs to cancel an appointment, they can just contact us, to let them know that we need to cancel the appointment, and we'll get that phone number to you. And then just cancel the appointment, and then we can leave room for the next veteran.
Right.
And that helps. You know, it helps us. It's
So
a
it won't
cycle
get this,
that helps.
the backlog.
Right.
They can say, well, I've been waiting 3 weeks, but
Right.
then if we have 3 or 4 no-shows in one day, that's someone else that could have moved up the list. Yeah, because we do have a lot of veterans that are in need of health care.
That's right. And nationwide, over 9 million appointments go on, you know, unaccounted for each year due to veteran no-shows. So that's a lot.
It
So
is.
we really want to, and I'm looking at some notes here that our department gathered, and VHA launching 1 million more clinic efficiencies campaign that will lead to the completion of at least 1 million more appointments within VHA in the upcoming year. So we're really taking this effort seriously. And so it's called the No-Show campaign. We kicked it off a couple of months ago. And basically just let us know if you need to cancel your appointment, and you can definitely make a big difference. The veterans can definitely make a big difference.
And just let the next veteran have that space. Of course, we know in private medical care, if you don't give them notice, they can charge you a $25 no-show. Of course, we can't do that with our veterans.
That's right.
And of course, we know sometimes they have caretakers or things like that. But I just thought that that was important. And of course, I follow you on social media. And so as you're putting the things out there for the Central Alabama, which includes Tuskegee, Columbus, and Fort Benning, I want to make sure that I know, because, you know, the veterans are very important in our community. And so we just need to make sure that you do your part, and then we need to do our part, and it works good for everyone.
That is true.
Right.
That is true. So the no-show campaign, don't forget about that. If you have an appointment, and we'll get the phone number to you, you definitely want to give us a call and cancel your appointment. Let us know, and we'll replace it with someone else. It makes a difference.
Right.
Yeah.
But you have something else. You know, I'm the one that always gets so jealous if you're doing something over in the Montgomery area, and I think our veterans should be having it here in Columbus, Fort Benning. You have something with the garden that's going on.
Oh, right.
And
the
I'm a little
veterans.
jealous about that.
Oh, it's awesome. I'm going to start, you know, my background is TV news, so
Right.
I love producing videos.
Right.
So I want to bring this to CAVHS. So I did a video, and I'll share it with you when we get through with it, but it's on the Veterans Garden. And it's amazing where we have veterans who are in our mental health program, who have conditions like PTSD, post-traumatic stress disorder, or, you know, depression, or just substance abuse. They're in the program to heal and to find peace, and they are. It's amazing to see how their lives have transitioned. And I interviewed some.
Really?
It's awesome. And so
they work in the gardens.
So there's a garden.
That's therapeutic.
Yeah, it's a veterans garden, and it's very therapeutic. So they go out there on like once a week on Thursday mornings, and it's a beautiful garden on the Tuskegee VA campus, and tucked away, just nestled away in the back.
Really?
And it's they grow squash, zucchini,
real food.
potatoes.
Not just plants.
No,
not
food. I'm
flowers,
talking
but
about
real food we can
yes.
eat. Oh my.
Cucumbers. I mean, it's strawberries, and so they're growing these food, and they're just out there, and they're learning, and they have, of course, it's a partnership, you know, with state agencies. We provide the water, and it's a partnership with nonprofit organizations, and then we have our Dr. Sordo, who works at CAVHS. She's one of their leaders there, and so we have a team of leaders from CAVHS who counsel them and work with them from the mental health program, and also what does it mean to garden? Right. And it's therapeutic. The veterans told me that I interviewed for the report that it means a lot to plant a seed and see it grow.
Right.
And it's just, they go out there and
that's success.
Yes, and the calmness of the morning, you know, it's beautiful. So,
and then being out and having a purpose.
Yes.
Yeah, because sometimes people, you know, they get sick, and in their recovery, you know, it's the medication and a lot of the things that they lost the desire to do. Then this is one thing that you can bring back. Because I mean, I didn't realize when you were first bragging about that garden that we don't have over here yet.
The veterans garden.
I just thought it was flowers. I didn't realize we were growing food.
Yes.
Yeah.
Yeah, it's food, and they cook some potatoes. They take them home and cook the potatoes.
So they get to keep the food.
Yeah, yeah.
Oh,
and they share it, and they grow these fruits and vegetables.
How
and they
cool
love
is
it.
that?
They love it.
And so you have someone from your team, from the CAVHS team, that's kind of overseeing it. and that's through the mental health program.
The mental health program, and so you'll see the video because I just finished producing it and writing it, so it's in editing now. So I'm excited about this.
Yes,
so
yes.
I'll show it
So
to you.
we have to push that around.
Yes,
But when you show it to me, then you're going to have to come spend some time
Okay.
over here
Okay.
to make sure our veterans get the garden too.
Okay, I will pass that on because
Look,
you
you know,
it
I
can
have no
happen.
shame. Well, you know, and of course, Mr. Reed and Mr. McHale, you know, they know me, so they know. And, you know, Dr. Linda, she knows I have no shame. I want my veterans over here,
Yes.
all of my friends, you know, my husband's a veteran, and all of our veteran friends. We want some things like that.
Yeah, I think it would be great to have a veterans garden at each, facility, at each CAVHS. You know, we're getting there.
Yes.
We're excited. I've been here a year now almost.
Right.
So
And you've
we have
done a lot in your short
and we have a
time.
wonderful director,
Right.
Dr. Linda. Boy, she's awesome, and we have a great team, great leadership.
And people are thinking out of the
Yes,
box.
yes.
That's what I like about this team. It's like, you know, and that's the thing I liked about Dr. Boyle. That was the way we used to do it, but if we can do it better,
Yeah.
and if it's going to make the lives of the veterans better, then certainly, you know, we're going to do that.
Yes.
But what we're going to do is we're going to take our break, go to our sponsor, but when we come back, I want us to make sure that we talk about the suicide hotline.
Okay.
Make sure that people know that our social work team, we have an awesome team that's over in Tuskegee, but they just don't serve the people in Tuskegee. They serve the people in the entire service delivery area,
right.
which includes Montgomery, Fort Benning, Columbus, and I have to keep saying that because when you hear the name Central Alabama, folks get confused and they just
Right.
think, oh, okay, that's just on the Alabama side. But you all have the
Georgia.
responsibility of helping to take care of us. So we're going to take that final break, go to our sponsors, and we'll come right back.
Okay.
Okay.
Very good.
We'll be right back afterward for some of our sponsors. Straightforward is brought to you by Warrior Outreach. Contact Command Sergeant Major Retired Sam Rhodes or Kathy Rhodes. The Hugel Foundation, enriching the community through Christian music support, community outreach, and the Georgia Through Photography Project. For more information, call B at 706-568-6431. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road, trusted by generations. Best Care, transforming minds and bodies, leading the way in the latest techniques of medical weight loss and wellness. Certified in family medicine and bariatrics, Dr. Blunt is ready to assist in the transformation of your mind and body. Call today, 706-221-6477, or visit bestcarecolumbus.com. East Alabama Endocrinology, educating and caring for those living with diabetes in Alabama and Georgia. 1400 Bradley Lake Boulevard, 3320 Skyway Drive, Suite 602, Opelika. Take charge of diabetes and live your best life. State Senator Ed Harbison, serving the citizens of Georgia's 15th Senatorial District and on the front line for veterans every day.
Walmart's reason for supporting Thurgood Marshall College Fund is simple. We like to win. And we have been given a lot of exposure to some incredible talent. And we also believe that it's a part of our responsibility to the community to give back. This is a great opportunity to do both. It's been a wonderful experience for us through the years. We've appreciated our partnership. We believe in return on investment, and we have definitely had a remarkable return.
And welcome back to Straightforward. I'm continuing my conversation with Kim Betton from that awesome Central Alabama VA healthcare team. Well, you all work very hard. I've seen it. I've been a part of it. Doing something every day. You got a team out that's here, even though they're based out of Tuskegee. Awesome social work team. Dr. Spann, Mr. Reed, Mr. McHale. I mean, they're awesome. I mean, I've seen them in full effect.
Yes.
But they're still here weekly. We're looking for our veterans that are homeless. You have wonderful resources for them. They can get shelter in addition to getting health care. We want them to be made whole.
Right.
We do. We want to leave, as Dr. Linda Boyle would say, we're leaving no one behind. No soldier will be left behind. So we have that going on. But as you and I both know, when we get to the holiday season, depression, even if you haven't been in a war zone and, you know, had some things that you've, you know, experienced in life, it happens to normal people. There's a high percentage of depression, suicides around Thanksgiving and Christmas.
It is.
So you all have a suicide hotline.
We do.
Okay.
We do. As we call it the Veterans Crisis Line. And you know, when we can save a life, that means a lot. So we want family members, friends, co-workers, you know, just everyone to look out. Please look out for the warning signs. And yes, the holiday season it really hits hard around holidays. But of course we see evidence of suicide, you know, year round.
Right.
And of course not just with veterans, but across, you know,
Yes.
all you know,
Walks of
people,
life,
all
yeah.
walks of life. So the phone number is 1-800-273-3255 and press 1. So they want to remember that 1-800-273-3255. And make sure I said that right. You have to see, you know, we're getting that age now.
We're mature.
Yeah, yeah. So that's I'm sorry, that's 8255. But we're 1-800-273-8255 and press 1. And we want you to, and we'll give you the graphic too to put up,
Right.
so you can see it. But we want you to remember the veterans. We have a hashtag campaign called Be There, the Be There campaign for veterans. So whenever you tweet about it, you know, we want you to remember that. That's important to remember a veteran. And so. It says many veterans, I just want to read this to them.
Okay.
This is important. Many veterans may not show any signs of intent to harm themselves before doing so, but some actions can be a sign that a person needs some help.
Right.
So veterans in crisis may show behaviors that indicate a risk of self-harm. So the following, I won't go through the whole list, but I'll mention some of the following can be all warning signs: appearing sad or depressed most of the time.
Okay.
Hopelessness, feeling like there's no way out.
Okay.
Anxiety, agitation, sleeplessness, or mood swings.
Very high highs and
Yes,
very low lows.
highs and lows. Feeling as if there is no reason to live. If you see or hear someone talking like that, that's important.
Yes, to pay
so
attention.
Give a hug. You know, ask, are you okay today?
Maybe they might just need someone to have a cup of coffee with.
Right,
Yes.
right. Listen, and it means a lot. So we ask our families to just all people can resonate with this, to always think of others, you know, keep your eyes open. And if you need some assistance, this is the number here, 1-800-273-8255 and press 1. That is the number. Earlier I said 3. That is not
Right.
the number. It's 1-800-273-8255 and press 1. And they can also chat online too. If you just go to va.gov or just Google Veterans Crisis Line, all the information is there.
Right. And if they just need someone to talk to, that's a 24-hour,
Yes.
365 days.
Anonymous too.
Right. So they can still remain, you know, it's confidential. No one's going to call up and say, do you know Sergeant Major so-and-so said he thought about, you know, killing himself. And I just think that's important because I do know of someone that actually went and gave their dog away, you know, to someone, and that was all a part of that plan. And people were just shocked, you know, that they gave the dog away, and then they went and, you know, and they made that decision because they felt like life wasn't worth living. And so we know that every day we hear it in the media. You know, we have veterans taking their lives. We have a lot of young veterans that have had 3 and 4 tours. You know, it's just different. And so we need to be paying attention because I know we've had some here and people were like literally shocked. And they're not necessarily all old people. So it's across all the
is.
demographics.
It is.
And so you, like you said, you need to be paying attention and listening very closely.
Because it can make a difference. And if anyone sees these warning signs, you know, they can call too and say, I'm concerned, you know, about a loved one, and they can, the VA will tell you the steps to take, and they'll give you some advice and to help you out. And it means a lot. So we want to save lives, and this is how we can all, like I always say, it's a cycle of success, is partnerships, and we love each other. We're a community.
Yes.
So we
are one.
That's right.
We are.
So we have to remember that.
Now there's other things that you've been doing, and you know I have to keep up with it because I want to make sure I get equal
We're
time.
busy. Yes.
But you all have been having some town hall meetings.
Yes.
And so you've done some throughout the region. But when the new year starts, you're all going to start that up again.
Yes.
And so that's a free, and what normally happens there is just information sharing.
Yes, the town halls are, you know, we have these all across the VAs, across the United States. We have these, and here in the Central Alabama Veterans Healthcare System, we have them at least quarterly, where our director and, you know, associate directors, we call them PENTAD, the directorate, they come out and meet with the veterans. It's
really?
open forum. Where veterans can come. We have usually at a city hall, or just we have an event where we have them, and we'll have well, not I said city hall, but we'll have one time we had in Daleville, we had a town hall at a facility there.
Right.
And then we've had them
It was at a
in
governmental
Brundage,
building.
yeah,
Right.
governmental building, and in Brundage we had a town hall there, and we have them at the VA. We had one in Montgomery at the VA there off of Chantilly. We had one there. So we get out in the community, and we want the veterans. We'll send out, and we have to get you on our Facebook and Twitter pages, because we really push it out that
social
way.
media, yeah.
Our social media. Just Google Facebook, Twitter, Central Alabama Veterans Healthcare System, and we'll pop up. But you, and hopefully we'll get on Instagram.
Okay.
So I'm working on that. But we want the veterans to come to the town halls to ask their questions.
Right.
And we want to let you know what we're doing. And I'm going to start also inviting speakers to come and speak at the town halls.
Right.
Because we want to engage that partnership. See, we want to engage our partners.
And
So-
make it a collaboration. And in
Right.
case it's something you all are not doing, the partners might know of a resource
Right.
that can help. And that was a good thing about stand downs, because you have all of these community partners coming together. Well, I just want to thank you, Dr. Boyle, that awesome
Yes.
team of social workers. I've seen you all in action, and I am very, 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 very proud and appreciative of what you're doing for our veterans.
Thank you. Well,
So
we
in the-
thank you too.
Oh, well, you
Because
know,
you're
I'm
there.
all for-
You're there. You're a big supporter. We really appreciate it.
Yeah, well, I'm all for the veterans, but we'll have you back in the new year.
Okay.
As you are working out the schedules for all the different activities, and we have to make sure that our folks get advantage of all those other great things.
Yes,
All
yes,
right.
indeed.
Well, thank you so much.
Thank you very much.
All right. This has been Straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.